Welcome to Noon Wednesday. I'm Special Projects Journalist Merv Seymour with Here and Now on PBS Wisconsin, filling in for Marissa Wojcik. Today is August 11th. Well, the push is on across the state to get more Wisconsinites vaccinated as parts of the state see a spike in the number of COVID cases. Here and Now reporter Will Cushman has been reporting extensively on the developments with COVID statewide. He joins us on this noon to talk about some of the good and the bad news in the efforts to get COVID under control. Will, thank you for joining us for this update.
Thanks a lot, Merv.
Let's start here. Give us a snapshot of how the state is doing as a whole with vaccinations and infections.
Sure. Vaccinations continue to climb kind of slowly over the last month. As of yesterday, about 53% of the state's residents had received at least one dose of vaccine. So it's a little bit more than 3 million people, a little less than half the state population. So just under 50% is fully vaccinated now. And as I just mentioned, those numbers are creeping up pretty slowly over the last month, especially when compared to new cases of the disease of COVID-19. Cases have really been spiking over the last several weeks. Just yesterday, the state health department reported about 1,500 new cases. That brings the 7-day average for new cases to about 1,100 new cases per day, which is the highest that measure has been since early February. So cases are climbing quite rapidly in multiple parts of the state, primarily kind of the Milwaukee area, but there are other areas as well, Chippewa County. So cases are climbing quite quickly right now.
And you report in more than 24 counties across the state, the vaccination rate is below 50% and below 40% in some places. Should we be alarmed by these numbers?
Public health officials definitely seem to be. They are raising the alarm about new cases, as are doctors working in COVID wards across the state. COVID wards are reopening in hospitals around the state. Some had closed because new cases of the disease requiring hospitalization had slowed down so much earlier in the summer. But yeah, with a fairly low percentage of people vaccinated in a lot of Wisconsin communities still, public health officials, doctors, healthcare workers are quite concerned at this present moment.
And you also report there are a handful of counties where the vaccination rates meet or exceed the goal of getting 70% of adults vaccinated. What are these counties doing that the others aren't, where the vaccination rates are low?
That's a really, really good question. I think as of yesterday, there were 8 out of Wisconsin's 72 counties where 70% or more of the adults in the county had at least started the process of getting vaccinated, so had received at least one dose. And yeah, it's hard to say. There are counties all over the state, includes Day County, Door County, a couple of rural counties up along the Lake Superior shorelines, so that'd be Bayfield and Ashland County, Ozaukee County in the Milwaukee suburbs, and a couple other counties around the state. And there's not a whole lot you could say, I guess, about their similarities. They're fairly different places with different public health departments. So I'm not sure if there's necessarily a winning strategy to getting those vaccinations up higher. But we know that in some places, like in Door County, a large portion of the population is older. It's made up of a fairly large number of retirees. And we know that older Wisconsinites, like elsewhere around the nation, are getting vaccinated at much higher rates. We also know that there is a political dimension to people's willingness to get vaccinated, at least in some areas. And we know that places like Dane County that are quite blue, very Democratic leaning, voted heavily for Joe Biden. Those are all kind of factors that have been associated with higher enthusiasm for receiving a vaccine. So I think it depends as much on the people living in the counties as it does on the strategies of local health departments in terms of getting vaccination rates higher.
So because of this Delta variant of the virus, there have been more pleas from health officials, community activists, and others for the unvaccinated folks out there to get the vaccine. How are people across the state responding to that?
That's another really good question. And it seems like at least some people are hearing those pleas. Well, we know that a number of healthcare systems in the state have recently mandated vaccination for their workers. That hadn't really been the case up until pretty recently when cases were spiking. And coinciding with that, it does seem that more people in the last week or two have decided to start the vaccination process than were starting it earlier in July. The average number of doses administered has crept up pretty steadily, not a ton over the last couple of weeks, but from about 5,500 shots per day to about 8,000 shots per day. So there are more people who seem to be heeding that advice, but public health officials definitely wanted to go higher.
And it's also worth noting, you mentioned Door County a little bit. They have a high vaccination rate among adults, but we also see an increase in cases there recently. Do we know what's happening with that?
That's another great question. And the same thing is happening in like places like Dane County that also have high vaccination rates. And I think what we're seeing is even in places that have fairly high vaccination rates, around 70% or a little bit under in Door County, there are still quite a few people who are not vaccinated who are getting infected. And then we also, the evidence is becoming clearer that the Delta variant, this very contagious variant that is spreading quite rapidly around Wisconsin and the United States, is likely associated with more breakthrough infections. So that would be people who are fully vaccinated who are nevertheless getting infected. And so that's what we would term a breakthrough infection. And we know that those are a little bit, we believe that those are a little bit higher with the Delta variant. So that is certainly part of the puzzle as well.
And Dane County health officials say they're over the moon with the high vaccination rates throughout the county, but I get the impression the numbers don't always tell the whole story. How can you have such a high vaccination rate in Dane County, yet I saw that vaccinations near the UW campus and in rural areas of east of Sun Prairie are low? How is that possible?
Yeah, I think it's because the rates are so high in some places. There's areas in, for instance, Verona, where the vaccination rate is almost 90%. That's a suburb of Madison. But I also talked to the vaccine deputy for Public Health Madison, Dane County. That's the combined health department for Madison and Dane County. And she said that the health department is kind of interpreting some of the local vaccination rate data with a bit of a jaundiced eye. Particularly, you mentioned the area around campus. She said that they're not putting too much stock into that what appears to be a lower vaccination rate in that zip code around campus, because there are a lot of students that they're expecting will have been vaccinated over the summer, and those vaccination records are likely associated with their permanent address, which for a lot of students is still where the address is where they grew up, not necessarily in Dane County or on campus. And then you mentioned some areas east of Sun Prairie. Definitely kind of the rural hinterlands of Dane County do have lower vaccination rates. They're smaller population, and actually the vaccination rates there are a bit higher than they are in most rural parts of the state.
And I also see that health officials in Dane County have serious concerns about the low number of African Americans getting the vaccine. Why are the numbers in this ethnic group lagging behind whites and other minorities? And what is being done about that?
That's right. A little under 40% of Dane County's Black residents have gotten at least one dose of the vaccine. That compares to about 2/3 of the county's white residents, about 60% of Hispanic and Asian residents. And I posed that same question to the vaccine deputy at Public Health Madison, Dane County. And she said that they're definitely dealing with some kind of longstanding issues of not a lot of great communication between the local public health department and healthcare providers with members of Madison's Black communities. She said that they're continuing to hold mobile vaccination clinics in predominantly Black neighborhoods. They're working with Black churches to try to spread the word on vaccinations. And she also mentioned that social media misinformation has definitely been an issue that the health department is having to combat among people across the community. But she said that is definitely an issue as well.
All right, let's move a little bit forward here and talk a little bit about the Delta variant. Does it make up a lot of the new COVID cases across the state?
It does. Last word from the state health department, it was over 80% of new cases were associated with the Delta variant.
And I know some vaccinated people out there feel extremely protected against the virus. What does the Center for Disease Control say about whether or not these folks should let their guard down because they're now vaccinated?
Right. Yeah. Especially, I think I am not surprised that a number of people are kind of confused about it's not super new at this point, but the newer CDC guidance that even fully vaccinated people wear face masks in public and closed spaces in areas with high transmission. And that's not to say that the vaccines are not protective. They're still very, very protective. In fact, I just got some statistics from the state health department last night about breakthrough infections, hospitalizations, and deaths in the state between January 1st and August 4th of this year. And the vast majority of infections in the state are associated with unvaccinated people. I've got the stats right here. About 153,000 cases in Wisconsin between January and August 4th were in unvaccinated people. That compares to about 5,000 cases in fully vaccinated people. So obviously a much, much smaller number there. And at the same time, there were over 6,800 hospitalizations among unvaccinated people versus about 300 hospitalizations for fully vaccinated people. And then almost 1,300 deaths between January and August among unvaccinated people compared to about 35 deaths in fully vaccinated people. So it's obviously a much, much, much smaller number of people are getting infected with coronavirus who are fully vaccinated, but then even a smaller number are getting severe symptoms, and a very small number are dying, especially compared to unvaccinated people. So the vaccines definitely still have a powerful protective effect. And at the same time, the new guidance to mask up in areas of high transmission is just as much, if not more, to protect unvaccinated people around you if you're fully vaccinated.
Is there any way to forecast what the numbers are going to do this fall with more people going back to school? The fall sporting season will begin and all this adds up to more large gatherings. Are there more concerns about public safety as we head into the fall?
I think there definitely are, especially with the start of the school year. We know that no children younger than 12 are vaccinated because they're not yet eligible for vaccination. And we're seeing a number of school districts across the state announcing that they are going to require masks for all students, faculty, and staff, regardless of their vaccination status, which is recommendation of the state health department right now. But surely a large number of school districts may have no mask requirement or some sort of hybrid mask requirement. And so, yeah, I think definitely the beginning of school has public health officials a little anxious about new cases. And then, as you said, yeah, I think we're getting to the point where large public gatherings are just happening again, whether or not they're necessarily prudent. We know that Summerfest is still on in the beginning of September in Milwaukee. Summerfest officials just announced actually that they are going to require proof of vaccination or a recent negative COVID test to gain entrance to Summergrass grounds. So that is one thing that they're working to do to try to reduce the risk that large public gathering poses. But yeah, it's definitely of concern going forward into the fall.
Yeah, you mentioned Summerfest, so let's talk Milwaukee. Health officials there say they see an extreme surge in COVID cases there. Help us understand why the situation gets this extreme label.
Yeah, it's because cases are just rising so quickly in Milwaukee County and in Milwaukee in particular. They've been rising much faster there than they have in pretty much any other part of the state for the last several weeks now. And we know that Milwaukee County has a vaccination rate around 50%, so it's pretty close to the statewide vaccination rate. So it definitely seems to be on the leading edge of of new cases and also hospitalizations. Hospitalizations are starting to spike in Milwaukee and the surrounding area as well. So it may be portending what might come in other parts of the state over the next several weeks.
Can they connect that surge at all to the Bucks celebration with all the folks coming out to celebrate the championship?
Yeah, there were actually several hundred cases of COVID were confirmed via contact tracing to be associated with celebrations in the Deer District or in the vicinity of Pfizer Forum, the Bucks Arena, and are believed to be associated with those really large gatherings and celebrations.
And do we know, Will, whether they're doing anything at all to slow the cases in Milwaukee because of this extreme surge?
Well, I think there, like everywhere, public health officials and doctors, et cetera, are really pushing vaccinations, trying to get as many people who haven't been vaccinated yet, which is still quite a large number of people, to take the step to start the vaccination process. So I think that's number one. Number two is really strongly recommending that people wear masks again in public settings, regardless of your vaccination status. And then really recommending that people I think, reconsider attending large public gatherings or reconsider potential travel, other potentially risky behaviors that could spread the virus.
It kind of feels like we're slipping back towards square one with the danger of this virus. What do you think about that?
Yeah, I'm smiling because it feels I think, like a lot of people, I feel a little chagrined at the moment. We just a month or two ago, it felt like we were seeing light at the end of the tunnel with the pandemic, and now it feels very much like deja vu, like last fall, with how quickly cases are increasing again. I would say that the one major difference, obviously, between this year and last fall is that so many people are vaccinated now. A lot of people still have to be vaccinated, but a little bit more than half of Wisconsinites are vaccinated against COVID-19 now, and so that in and of itself has a really strong protective effect, not just for you as an individual who's vaccinated, but for the entire community. There are clearly still a lot of people who are unvaccinated and don't necessarily have immunity through prior infection, who are vulnerable to the disease. And there are definitely vaccinated individuals also who are vulnerable, whether they're immunocompromised or whatnot. So there definitely is still quite a risk, especially to hospitals. Hospitals are seeing a lot more COVID patients, and some are recommending or choosing to maybe push pause on elective procedures, or are really thinking deeply about their care models going forward over the next several weeks or months because of the definite strain that all these hospitalizations are having on their infrastructure and on all the workers. So I think that's something that is definitely of concern. But for average vaccinated person in Wisconsin, I would say I personally, I'm fully vaccinated. I feel less anxious about the pandemic right now in this moment, even given it's still a very serious issue for the community. But I feel less personal risk than I did last fall when I wasn't vaccinated at all.
All right, we'll have to leave it there. Here now, reporter Will Cushman, thank you for the update and your excellent reporting on the COVID crisis across the state.
You're very welcome. Thanks a lot, Merv.
All righty. For more on Here and Now in PBS Wisconsin, visit pbswisconsin.org. Thank you for joining us this noon Wednesday. I'm Merv Seymour. Have a great day, everybody.